Mumbai civic body's new sample data, only 5% of those who are fully vaccinated will be getting infected with the Omicron variant, and those people, in fact, will need hospitalization. That is what this data says, while 17% of those non-vaccinated need hospitalization. Now, a sample of 376 Omicron positive patients was taken, in which 237 were from Mumbai alone. Out of this, only 7 of the 128 fully vaccinated patients needed hospitalization, while 18 of the 103 non-vaccinated patients needed hospitalization. Now, this data also suggests that Omicron was less deadly than the previous variants. In fact, to discuss this, I'm now joined on the broadcast by Dr. Yatin Mehta, who is the chairman of Medanta Institute of Critical Care. Dr. Mehta, thank you so much for joining me on Mirror Now. Very important data that is coming to light, but something that all of us do know at the back of our minds, that you have to get vaccinated so that this particular threat of Omicron and in turn coronavirus does not really go to the extent of you reaching the hospitalization stage.
Yeah, you have, I think, told the statistics quite clearly. I think it just re-establishes the two facts. One is that vaccination protects you against severity of the disease and hospitalization, right? This was 5% who were fully vaccinated were hospitalized, against 17% who had not received a single vaccination. So this, I think, should take care and close the chapter about vaccine hesitancy. Fortunately, it has been low in India. So I think everybody should get vaccinated. And second thing, it emphasizes that Omicron, fortunately, is less virulent than the Delta variant. So these are two things which are now confirmed by the Indian data. And I think we should respect it, and everybody now should strictly follow that. But that also proves, Neha, that Omicron is not completely 100% safe. Most of the people think, oh, I got Omicron, just a little bit of sore throat. No. Still, despite vaccination, 5% of the patients can deteriorate to require oxygen therapy or hospitalization. Therefore, we should treat every COVID infection as a serious infection. Consult your doctor, but please do get vaccinated.
Also, Dr. Mehta, very important point that you raised over here. We are also looking at the relaxation of COVID curbs while we talk and discuss about this particular data. Now, since we are talking about people who are still unvaccinated, as you rightly pointed out, that vaccine hesitancy is still very less when it comes to our country. However, there remain those people, and hence the curbs also said, let's say if we are talking about just Mumbai, no local travel if you are not yet fully vaccinated. Do you think these curbs need to remain so that people actually go ahead, get themselves vaccinated, because coronavirus is still there? We could possibly look at a fourth wave in the month of June.
See, why did we lose more? US and Western Europe lost more patients and had more severe problem than us in the third wave, because many of them did not get vaccinated. There was vaccine hesitancy. Okay? So probably that is what must have protected us. And I think still one should maintain the discipline. And I think double vaccination, because it is not only a question of your own safety, it is also a question of your social responsibilities and safety of other people. So if you're going to, say, a mall or in a train or in a bus, you should be double vaccinated. That is simple. Otherwise, take your own car and go. I mean, you have certain responsibilities towards the society, and this is what it should be done.
Right. And Dr. Mehta, before I let you go, one particular thing that you would ensure that all the people who are watching this broadcast, they follow when it comes to that COVID protocol, because as things have started to open up, even in our offices, that occupancy level is just going up because of the reduced number of COVID cases, thankfully. But we do not have to let our guard down. So one thing that you would ensure that people follow.
See, what are the things which we have learned over the last 2 years? We have learned that COVID can become severe and you can die because of that. What are the things which are definitely going to protect you? That is vaccine and masking and safe distancing. So I think these are the things which must be followed. We have realized that because of this putting on a mask, we have substantially reduced other respiratory diseases. Flu has gone down, TB has gone down. I think,
Absolutely.
and keeping the hands clean, these are all good things which will prevent you from other infectious diseases. So I think these practices should continue at least for the time being.
Absolutely. Dr. Yatin Mehta, thank you so much for joining me on Mirror Now with all those very, very important inputs that are much required for people to adhere to in the wake of the cases that do seem to be going down. But we have to ensure that we do not drop our mask because the coronavirus is still here, still pretty much here. We still see, cases that are actually springing up every now and then. So we have to ensure that we do not let our guard down, even as the curbs are reducing when it comes to the COVID curbs that we're talking about in various states of the country.